We are at the beautiful Yacht Club today, where we're meeting consultant orthopedic surgeon Mr. Alistair Pace. Thank you for your time, Mr. Pace.
Good morning.
Thanks for giving us this interview. I'd like to go back to your childhood. Tell us a bit about your childhood.
When we were young, we were brought up in a village of Balzan, which is in central Malta, and we lived in that. Most people probably would know this house. They live in Balzan. It's a big green house in the corner there. I have a brother who's younger than me, and my father's a doctor. So my childhood, was very similar to children of my age. 45 years ago, when I was born. We went to school. I went to nursery school in Attard. My brother and I used to have the normal tit-tats of young children. We had a big house, we had a lot to explore there in the house. We had our toys, we used to go across to the swings in front of our house. And we were lucky because my cousins used to live very close in Attard, so we used to meet them very often and have the normal childhood shenanigans, So I had a very, very, very memorable childhood. When I was young, however, we moved from Malta to Saudi when I was about 6. So my childhood, I remember part of it being in Malta and part of it in Saudi. Now, since Saudi was a bit of a cultural change. Still loved it, but it was very different to Malta. Saudi, the country as a country is very different to Malta. The cultural issues, the people are very different in Saudi. I grew up there with a lot of British and American friends. We used to go to a British and American school there. We had a lot of emphasis on sports and outdoor activities, so we used to be involved a lot in sports days and swimming galas. But my father was always emphasized the importance of education and studying, so he never let his lead off us. So he made sure that we do our homework every day. But he used to give us the time to enjoy ourselves as well with friends.
So your father being a doctor, did he have time to spend with the family?
Yeah, my father, he's a professor of anatomy. He's retired now. And at the time when we were young in Balzan, he used to have a clinic there in the corner. And I used to see him come with patients. Patients used to come along and he used to see them. My father had a good work-life balance. He used to be very dedicated to his patients, and also as a professor of anatomy, he had his daily lectures and exams, but then he used to always spend time with us. And we also have these family days. And when we were young, we used to go regularly to Gozo, in summer, and we spend weekends there. We have a flat there, actually. And I remember, going boating with my brother and fishing and swimming. And, during the other days and winter, etc., we used to go for walks when we were young in countryside. We had San Anton Gardens, was very close. So we used to go walking there. And then in Saudi, again, it was a bit different. Because in Saudi, my father was still a professor of anatomy in Saudi. And when we had started school, we had made new friends there. Activities outside in Saudi are a bit restricted, so everything was kind of within the confines of the compound we used to live in. But, it was still enjoyable, have experiences which I remember and memories. So, memorable childhood.
At which point did you decide to do medicine?
Well, I always wanted to become a doctor. So my father, as I say, is a doctor, and I used to see him, seeing patients. I was always fascinated by him using the stethoscope and seeing patients. And my father kind of always pushed us as well to become, my brother is a doctor as well, in fact, and he always pushed us to become doctors. I mean, I was always interested in being a doctor myself. I used to find the doctor profession a very satisfying profession, because with the experience and the knowledge, it's incredible how a doctor can make such a big difference to a patient's life. And it's a profession. This is respected because of that reason. It's not a 9-to-5 job. It's a job you do because you enjoy doing it, both body and soul. And at the end of the day, you can say to yourself that you've done something physically to a patient, that you've helped him in a measurable way.
Yes. So you came back to Malta, and how did you fit in with Maltese life again and school life?
When we came back, it was a bit of a shock, because I came back and I started schooling in St. Edward's, and I was about, I think I'm Form 5. So, and that was about 1987, 88 time. I mean, in Saudi, sorry, the aspect of schooling is a bit different to Malta. They make a lot of emphasis on outside, activities, extracurricular activities. We did have quite a lot of, lectures and lessons, but there wasn't the emphasis on getting grades in, O and A levels. So when we came here to Malta and we started St. Edward's, my brother and I, we found, the schooling the emphasis a bit more different. It was here is more geared to getting your A levels and O levels. Obviously we had started schooling here at a later age. We didn't know very many friends here. We had to start anew. We had to make new friends. So it took us a couple of years kind of to settle and bed in. But then once we got up and running, we got used to the system. We fitted in nicely as well here. So
that's good. So your O levels, A levels, and then you moved on to university, graduated in medicine. Why did you choose orthopedic surgery?
Oh, that's a very, very good question. So after I studied medicine, I specialized as a surgeon. And I wasn't quite sure initially whether I'm going to do general surgery or orthopedics. I think at the time it gave me the house officer jobs I was doing after I graduated, gave me the time to experience both specializations and see what fits in for me, what I like, what I enjoy doing in terms of surgery. And I found orthopedics more fascinating in that the subject and the specialization for orthopedics is more varied. You have small operations, and they give a discernible quality, improving quality of life to the patient. And I found also orthopedics being more predictable and fits in with my kind of lifestyle. And when I decided then to proceed to specializing in orthopedics and I went abroad, I went through the training program there. I worked in about 16 hospitals in the UK, actually, and I decided that orthopedics was the specialization for me in terms of how I wanted to, manage patients and how I wanted to spend my life as a surgeon.
How long did you spend in the UK at that time?
Well, I went in 2002, UK in 2002, and I started my orthopedic training as a house officer, senior house officer in 2003. And then in 2006, I became what's called a registrar, which is a trainee on a specialized training scheme for orthopedics. And this took about 5 to 6 years until I completed my fellowship exam, which is the exam you do to be specialized as a surgeon. And that was around 2010. And then I became a consultant in 2011. So nearly 10 years ago now. Time flies.
Do you have a favorite place in the UK?
Well, I love York. York, we used to live in York actually before I came to Malta, and York is a very old walled city, which actually reminds me of Valletta. Beautiful bastions, and very well preserved, and also surrounded by beautiful countryside. So it's got the benefit of being a beautiful city, but also at any time you can walk out of the city and you're in nice, lush countryside. I don't fancy or like big cities. I find them too overwhelming, and the traffic. And And some of the big cities, unfortunately, in England don't have, Birmingham, Manchester don't have a particular characteristic to them. But York has that particular charm, which I like.
And beautiful architecture also.
Yes, yes. I mean, the Minster there is absolutely beautiful if you've been to see it. So.
A bit about your family life. Your wife's a doctor. Where did you meet? And how do you work family life out together?
Yes, my wife's a doctor, and we met in Britain. And she used to work in my hospital. I mean, being a doctor, there can sometimes be a clash of discussing patients, so we try and avoid talking about work as much as possible. We have 2 young children. They're 4 and 2, Caroline and Daniel. Also, they need lots of attention, particularly at that young age, as you can imagine. And I'm sure you had, when your children were young, you had the same kind of challenges. And, we have to try and balance my work and her work. So at the moment, as I work mostly privately, and my wife works at Mater Dei, she does lots of shifts and sometimes night shifts as well. So we have problems with childcare, and we have a nanny who takes care of our kids. But we try and find time specifically for us as a family, and we enjoy ourselves as a family. In summer we have a boat, and we make it a point of going at least once a week on the boat for a day. During winter we enjoy going for walks in the countryside. So we try and find time. I think the challenges nowadays in life are, your profession takes you on a road that, if you don't make time for yourself and your family, you won't draw a line under your work. So you have to physically find time and say, this time is for us, this time is for my family, and I'm going to enjoy my family.